Dr. Salma Aziz, and today we're going to talk about hammer toes. I just want to start off by telling you that we can spend over an hour just about discussing different types of hammer toes. There are different treatments that are available depending on how advanced the hammer toe is. So this topic is vast and we can discuss a lot of different variances. However, my goal today is going to be to give you the generalized presentation of how a hammer toe presents and basically the generalized treatments that we have to offer. So again, you know me, I gotta show you. When we're talking about the hammer toe, we're dealing with the smaller toes or the smaller bones of the foot. In particular, for looking at this, for example, the second toe. The second toe has 3 bones to it. There's a proximal phalanx. This is the bigger bone. There's another one right in the middle called the middle phalanx, and then right underneath our nail there's a teeny tiny one called the distal phalanx. It's kind of hard to see, but it's right underneath our nail. And in order for the toes to be straight, all of these 3 bones have to basically function in a straight manner with one another to be able to sit straight. Is as easy as I can put it to you. But what happens is, and the cause of this could be genetic, it could be traumatic, you sustained an injury and you didn't go see your foot doctor and the toe healed wrong, or arthritis due to other injuries. Those are all common causes, but essentially what happens with a hammer toe is this. Those little joints, they start to buckle, and when they buckle, what happens is the toe does not have enough room to sit straight. Because it does not have enough room to sit straight, it starts to buckle and the top becomes more prominent. This then rubs in shoes, causes irritation, and if the irritation is bad enough, that's when you end up going and seeing your doctor. My goal today is to teach you guys not to wait until that irritation gets bad enough. It's to make it that when you notice that a toe is starting to become deformed, it's sitting up more prominently, it is then that you should go in and have it reviewed. Because if we catch a hammer toe early on, the treatment becomes a lot less invasive and a lot more successful. And we'll get to the treatment in a minute. But if we wait too long and we allow these joints, these little toe joints, to become buckled in more of a rigid position, then the treatment tends to become more surgical. Because unfortunately, once something enters that rigid level, nothing from the outside world can bring it back to a normal position. So my goal is to get you to seek treatment early on and avoid surgery. But all of those of you that did let it go too long, don't worry, because the surgery for this is not very tedious, and we have great results and success rates. Now, talking about the hammer toe that is caught early on, again, if you remember from other videos, we've discussed this before, the main reason of a hammer toe is the lack of mechanical balance. When that mechanical balance is missing, what happens is the toes function improperly, and like I said, buckling occurs. So if we recognize this early on, we go to our favorite thing, which is a controlling custom orthotic, and by incorporating that into our shoes, what can happen is, as I've shown you before, mechanically the foot becomes more stable, the toes are functioning better, and there is a balance between the muscles and tendons on top of the foot as well as on the bottom of the foot, and therefore the toe is kept in a more straight manner. Versus no orthotic, unbalanced foot, imbalance between the tendons up on top and on the bottom, and the creation of a hammer toe. So remember, hammer toes don't always have to be dealt with surgically. Early detection, early treatment can often prevent these from becoming surgical problems. And even if they have become rigid in nature and we have to institute surgical treatment, again, if it's caught early enough, even the surgery will be a lot less invasive. And so in order to maintain straight, pretty toes, remember, don't ignore any curly or contractures that you see in your smaller toes of your feet. Thank you for watching today, and hopefully today's educational message was of use to you guys. Have a great day.